Well, if you or a loved one have ever faced a severe cancer diagnosis, you know the feeling all too well. It's just this overwhelming flood of medical information, but somehow very little actual clarity. So let's jump right into this explainer and explore exactly how elite German academic medicine handles the absolute most complex oncology cases. Today, we're breaking down a very specific, highly structured approach to cancer care, the Multidisciplinary Tumor Board in Germany. We're going to look closely at how this collaborative process actually works, using the framework provided by Euromedical Expertise, which is a specialized medical coordination service.
We absolutely have to start by answering this critical question, because for any patient or family navigating a severe diagnosis, a single obvious treatment path is, well, pretty rare. Often, patients are just left trying to piece together conflicting recommendations from different doctors all on their own. So, why does a tumor board matter so much? Because when you're dealing with major life or death decisions, the actual way your medical data is reviewed can completely alter your treatment pathway. In fact, research frequently shows that when complex cases are reviewed by a multidisciplinary team, the diagnosis or the treatment plan changes in a massive percentage of cases. We're talking up to 30 or 40% of the time. That is literally a life-altering difference.
So here is our roadmap to get you out of the confusion and into some structured clarity. 1. What is a tumor board? 2. Who needs this review? 3. Physician-led coordination. And 4. Your pathway to German medicine. Let's get into it.
Starting with Section 1, what is a tumor board? The power of collaborative oncology.
The absolutely crucial takeaway here is that this is a collective review of your case. It's not just a single doctor working in isolation. Instead of each specialist looking at your file separately and sending over separate, sometimes totally contradictory notes, a multidisciplinary tumor board brings everyone into the same room or, the same secure conference. They look at the exact same imaging and pathology results at the exact same time. They discuss, they debate, and ultimately they formulate one single integrated treatment plan. And this is the part that really brings the team aspect to life. You've got medical oncologists, surgeons, radiologists, pathologists, and radiation oncologists all at the table. Think about it. A surgeon is naturally going to look at a tumor a bit differently than a radiation oncologist does, right? A pathologist understands the cellular makeup, while the radiologist maps out its exact physical boundaries. By bringing all these highly specialized minds into one unified conversation, the board ensures no angle is missed. Every single viable option, from targeted therapy to precision oncology, is weighed together. The contrast here is honestly night and day. When specialists work in silos, you often end up having to play the medical messenger, right? Carrying heavy files from one office to the next, hoping everything connects. A tumor board completely eliminates that. It takes that fragmented advice and turns it into a comprehensive clinical consensus. Moving on to Section 2, who needs this review? Identifying the ideal candidate. So who is this actually for? Well, if you're facing major treatment trade-offs, like having to choose between surgery, radiation, or systemic therapy as your very first step, this board is going to provide some much-needed clarity. It's designed for those moments when the path forward just isn't simple. Plus, for international patients seeking a rigorous oncology second opinion in Germany, this structure makes sure that your second opinion isn't just one doctor's thoughts, but the combined intellect of an entire academic department. We're really talking about highly complex cases here. Things like brain tumors, glioblastoma, lung cancer, pancreatic cancer, and sarcoma. These are the challenging diagnoses where a multidisciplinary discussion is absolutely vital for finding the best pathway forward. And for advanced stage 4 cancers, this review is especially crucial for evaluating cutting-edge options like precision oncology or immunotherapy, which are currently being utilized in top German centers. Okay, Section 3, Physician-led coordination and the Euromedical expertise difference. Now, this is a vital distinction you really need to understand. There is a huge difference between a travel agency and true, clinically trained medical coordination. When you're dealing with complex oncology, a simple booking agent might know how to get you a flight or a hotel room, but they can't medically audit your pathology report. They don't know exactly which subspecialized academic research chair actually needs to see your case. That's where Dr. Hind Hlali comes in. She acts as your expert guide, and she audits your file with the authority of a German-licensed, board-certified specialist physician. Because she has direct residency mastery within these specific German hospital hierarchies, she deeply understands the subspecialized protocols. This isn't just administrative help, folks. This is physician-led precision matching to the specific academic research chairs that your case requires. Which brings us to our final section, Section 4, your pathway to German medicine and navigating the logistics. So how does this all practically happen? First off, distance is absolutely not a barrier. This entire journey begins from the comfort of your home with a remote file review. You don't have to make any decisions about traveling to Germany or Switzerland yet. It's a highly systematic 5-step process. Dr. Hlali reviews your files remotely, coordinates with the right academic center to present your case, gets a hospital estimate, and only then, if you decide to proceed, does the team step in to handle all the travel, accommodation, and continuous follow-up. To get that remote file review started, you just securely submit your specific medical documents. We're talking recent oncology reports, imaging studies like CTs, MRIs, or PET scans, and especially your pathology and biomarker testing results. The more comprehensive your initial file is, the more precise the tumor board's review can be. It lets the radiologists actually see the history and the oncologists understand exactly what treatments your cancer has already been up against. And you are fully supported throughout this. Whether you're advocating for a family member from the United States or from the Gulf countries, Euromedical Expertise provides culturally fluent 24/7 communication. They handle it all in English, Arabic, German, and French, entirely removing those stressful language and logistical barriers. Because let's be honest, dealing with cancer is hard enough. Having true peace of mind regarding the logistics means you and your family can just focus entirely on the patient. So, I'll leave you with this final, incredibly important thought as you navigate your treatment journey. When you are dealing with a truly complex diagnosis, can you really afford to rely on just one isolated opinion? Or is it time to let an entire team of elite German experts review your case together,